My name is John Clayton. I am a general surgeon here at Mason Health. In that role, I see patients in an acute setting for Mason emergency room and for patients that are admitted to the hospital as inpatients. I also see patients here in Mason Clinic for outpatient surgical issues ranging from hernias of the abdominal wall, gallbladder issues, breast cancer, skin lesions. And we also do a lot of consultations for colon cancer screening. There are various tests that are available for screening for colon cancer. When I see patients here in the clinic, there are lots of people who are here to discuss a colonoscopy because their primary care doctor discussed that with them and sent the referral to us. While they're here, they frequently say, hey, are there any other alternatives to colonoscopy? There are, and so we have some of the numbers here on the board. A Shield test is a newer test. It is a blood test. It detects colon cancer with 83% sensitivity. Cologuard Plus, which has been around a little bit longer as a stool-based test, and it detects colon cancer with 95% sensitivity. And then colonoscopy, which has been around for decades, detects colon cancer with 95% sensitivity as well. Anytime I talk to patients, though, about colon cancer screening, I also talk to them about other diagnoses that can be found doing a colonoscopy. So these same numbers here on this board, when we look at colonoscopy, if someone has an advanced colon polyp that is not yet colon cancer, that's any polyp that is bigger than 1 centimeter in size, a colonoscopy will detect that still 95% of the time. Whereas these other tests drop off significantly in their ability to detect polyps. So anytime we're doing colon cancer screening with a Shield test or a Cologuard test, we are many times missing the opportunity to find polyps, which would let us know that that patient has an increased risk of developing additional polyps and possible colon cancer in the future. Once again, anytime that we're diagnosing colon cancer early, or large polyps early, the outcomes are better than if we find those later. Colonoscopy versus Cologuard or the Shield test. There are some pluses and minuses for each one. For a colonoscopy, one of the bigger negatives for the patient is that it is a procedure that does come with some risk. We're trying to work our way all the way from the rectum to the connection between the small intestine and the colon. And that requires us going in with a flexible camera. Along the way, if there's any polyps or any other abnormal findings, we may remove them through the colonoscopy or take biopsies. And that does introduce risk. The risks of a colonoscopy are bleeding or putting a hole in the colon. Those risks are very infrequent. Less than 1 out of 1,000 patients will have a complication related to a colonoscopy. The benefit of these other tests is that they don't carry that same risk of a procedural injury, but they do have a much less chance of finding additional polyps that would be caught with a colonoscopy. Now, if you are average risk and you have a colonoscopy with no polyps, you don't need another colonoscopy for 10 years. That is an additional benefit over these other tests, which have to be done at least every 3 years and sometimes annually, depending on which study you read. Colonoscopy, if normal, is good for 10 years. 10 years is a long time, so if you have any symptoms during that time that would make us concerned, weight loss, anemia, bleeding, we might do it sooner, but if you're doing well, you only need a colonoscopy every 10 years. Now, if you do have polyps that we find, it depends on how many polyps and how big they are. And we do colonoscopies sooner in that case. It starts at 7 years and goes down depending on how big the polyps are and how many you had.